What is your gripe?
My gripe is with respect to a doctor's office visit. So I suffered a back injury and I called my orthopedic doctor to get an appointment. I wasn't getting better on my own. It was something I was hoping I would heal, but I needed more assistance through a doctor's office. So I scheduled an appointment. I got referred to a pain management doctor, and I went to go in and see the doctor. I explained to her what my situation was, what I could do, couldn't do. I explained that I work in a job that's labor intensive, and I needed two things from her. One, it was to have her office fill out some paperwork that's required by my employer. Two, I needed some time off of work. Being at work, I just wasn't going to be able to continue and without doing more damage to my back. So the problem is she did not want to fill out the paperwork. She says she doesn't do that. It was a disability form that needed to be filled out, and she basically refused to fill that out. And I was kind of taken back by that. I was shocked. Like, it was something that I kind of thought that's what they do at doctor's office. You know, you explain your situation, and they would listen to you, and they would give you some time off of work. It's something that definitely threw me for a little bit of a setback. She also didn't really want to write any time off for me from work, which is something that I also needed. So it was frustrating, and she just didn't really quite want to listen to what I had to say. She really just was more interested in moving me along, not giving me the time off of work. She was more quick to offer like medications like drugs and or steroid shots, which is something I didn't want to do. I was interested.
How severe was the injury?
It was severe. It was a herniated disc, and it was very painful.
Are you actually in pain right now, sitting there?
Not in this position. So, but you know, it progressively did get better. You know, it is healing. However, she didn't quite want to listen to what I had to say. She took it to a point where she was just interested in moving me along. Now, if I wanted a shot, she was more than happy to do that. But the problem I had was she was more quick to put a needle in my back than to put pen to paper and write me some time off of work.
What was her diagnosis?
We didn't have one yet because I had to schedule an MRI. So she, you know, she just didn't want to give me the time off until I got the MRI to see what the results were. So I left her office. I called back my orthopedic doctor's office. They referred me to another doctor's office that deals with spine injuries. And by the time I saw that doctor, we had the results from my MRI. It confirmed that I had a herniated disc, and from that point, went to do physical therapy to heal. So, you know, my gripe is that the doctor didn't take the time to listen to me. I kind of felt like she thought I was lying, like I was trying to get out of work, like I was trying to scam the system. And maybe she's never suffered a back injury, so she actually doesn't know what it's like to have pain like I had. And she just wanted to move along. I think we're in this environment that it's like push people through, get them in and out of the office like a revolving door, and let's see how much money we can make and not really care about the patients.
How did that make you feel on a human level? Like, how did...
Well, it disturbed me because it was like I'm beholden to a doctor to allow me to rest and have some time off of work. And it's like I have no control of my own body or my own needs. I had to leave it up to basically a stranger. And I'm a stranger to her. There's no relationship. She's not my primary care physician. So that was very frustrating. And you're paying for a service, and yet they basically have control over you. Because I can't go to my employer and just tell them I'm injured. You know, everything needs to be documented, and it needs to be documented by a professional.
Do you feel like it can change? Do you feel like they could have done a lot better, or
You know,
So, how?
ironically, I think it's like my impressions when I went to speak to the administrative staff there. It's like it was all a reflection of the practice. Like each person wasn't very helpful. They just clearly wanted me to move along. So you know, it's almost to the point where I would almost want to deny the payment and say, you know what, you didn't really provide any services for me. I'm not paying for this. But one of the problems you run into when you're in this medical group and they have a patient portal, all the notes and communication are for every doctor to see within that group. So, you know, you kind of want to keep things on a friendly level because you don't want to be shunned by somebody else who thinks like you're a bad seed or something. And that's what like hurts. It's like the upsetting part is it's like I feel like I'm doing something wrong where it's like I just needed something from a doctor and they did not want to provide that.
For a legitimate injury.
Yeah, 100%. And she wouldn't wait until we got the results of the MRI. Like, wouldn't give me time off until we got the results. It's like, so I had to go back to work with the injury and basically start the whole process all over again with somebody else.
Do you think that aggravated your injury more?
No, I just had to limit things at work, which puts more emphasis or pressure on the people I work with. So they have to pick up the slack, which isn't fair to them. So, you know, it's just like it creates more stress for a stressful situation. You know, I believe in the body is very good at healing itself, and sometimes it just needs time. It doesn't always need drugs or a shot or surgery. You know, it needs patience.
So, what could they do to change the experience and to make it better, in your opinion?
There's a few things. I mean, I think kind of like on a bedside manner approach, I think the doctor can make you feel more comfortable. The doctor could believe in you. Have just patience to be able to recognize that not everybody that comes in here is looking for time off of work because they're faking an injury or something, but you know, you need to definitely err on the side of caution and go with what the patient says. I think she could have asked me more questions of what my physical limitations were prior to getting the MRI, and then when we got the MRI and see that there was a significant injury to my spine, that she could have related that to what I discussed with her on the first appointment. Her staff could have been a little more helpful. It just didn't feel like they wanted you there. Just move you along. So just a few minor things. Just basically like back to basics, human health care about your patients. Yeah, so that's my gripe with her and the office and the situation. But I guess you learn from these things, and if you remain calm and polite, and you just need to move on and regroup and restructure. So, thank you.
All right, thank you.